The Legionnaires disease outbreak in central Harlem is causing concern among those who live in that area.
That's right. The numbers have climbed since it was first reported last month, and now 3 people have actually died. Good Day's Haley Fixler is in Harlem this morning, where the mayor was just yesterday, with what he's telling people. Good morning, Haley.
Good morning, Dan. Tina, well, officials say the outbreak has been contained, but they say it's still really important for people to know what's going on so they can pay attention to any symptoms. Getting out the word is a big priority for officials. In fact, we just met a man a few moments ago who came up to us, asked us what was going on, what was Legionnaires, and how he could contract it. So again, information and education is key here. Now, we do know that 70 people right now have been diagnosed with Legionnaires, all in a cluster of 5 zip codes. Here's what health officials tell us. They tell us that this is a bacterial pneumonia. They say that you should watch out for a cough, fevers, chills, muscle aches, and shortness of breath. They also say that if bacteria comes in contact with your skin, it can cause infections. And if it gets into your sinuses or your bloodstream, it can spread and cause some serious issues, especially for the elderly or people who already have health conditions. Now, again, Legionnaires is bacterial. It's contracted from breathing in contaminated water mist. It is not spread from person to person. Now, we're told this outbreak stems from at least 11 cooling towers here in Harlem. The cooling towers, of course, are on roofs of buildings, and they release excess heat from the building in the form of vapor or mist.
Cooling towers, which are usually on the top of buildings and help to cool down and do air conditioning and other things, unfortunately had bacteria, the Legionella bacteria, in some of the water that became aerosolized as droplets and spread outside of buildings, actually, in the community in those 5 zip codes.
While, of course, this is concerning for a lot of people, officials say they have cleaned the contaminated cooling towers. Mayor Adams went out in central Harlem yesterday to educate people and to let them know what's going on. Officials say it is safe for people to drink water, to bathe, shower, cook, and to use the air conditioners. However, they do tell us there is about a 2 to 14-day lag time for someone who's been exposed to show symptoms, so there may be more cases popping up. Adams says they are still working to prevent even more people from inhaling the bacteria.
We are having all of the buildings in the area inspect their cooling system to make sure that if there's any trace of Legionnaires disease, that they have to rectify the problem within 24 hours, which is very important. And we're seeing the compliance that's needed, because this is how we make sure that this Legionnaires is under control and doesn't harm other New Yorkers in this area.
Now, there have been other outbreaks in the city over past summers, and that's because the bacteria really thrives in warm weather. Officials say if you don't feel well, go to the doctor as soon as possible, because the faster you get diagnosed, the faster you can get some treatment, and it's just better for everyone. Live in Harlem, Dan, Tina, back to you.